Hi, my name is Vic Veer. I'm an ENT consultant surgeon that works for the NHS. I work at the Royal National Throat, Nose and Ear Hospital in central London, and I also work in King George's and Queen's Hospital in Essex. My job on the NHS is to provide care for snoring and sleep apnea patients. And I try and give a range of treatments from mandibular advancement devices, CPAP, and also surgery, which is what I'm trained in. I'm a surgeon. In this video, I'm going to tell you about exercises for your tongue and your throat, which are meant to tone up the area so that when you're sleeping at night, it doesn't flap around so much to cause the snoring, and it doesn't collapse down like that, which causes sleep apnea. Now, I've already done a video like this, but this is an updated version with slightly better sound, slightly better lighting, and basically I'm trying to make it shorter as well because everyone complained that the last one was too long. This video is primarily for my NHS patients to help them understand what exercises I want them to do at home, and the main reason for that is that it's quite difficult to explain these exercises on a piece of paper in the letter to them, but also because I do not have access to a myofunctional therapist. A myofunctional therapist provides these exercises as well as lots of other things like posture, breathing, and other things. So really this is as close as I can get to the real thing by providing you a video about these exercises. It certainly doesn't replace myofunctional therapy, but at the moment it's the best I can do for my NHS patients. Before we launch into the 5 exercises that I think you should be trying to do at home, it's worth stating that there is increasing evidence with these exercises. And it seems that the more you do these exercises, the more you tone up your throat and stop it from collapsing down during sleep, the better your snoring and sleep apnea. Camacho wrote a paper about this, suggesting that myofunctional therapy reduces snoring and sleep apnea by approximately 50%. And the fact that exercises have no real complications or risks, it really is worth a go because there's not really much to lose apart from a bit of time each night when you do these exercises. They roughly equate to about 8 minutes each night. So as I said, there are about 5 main exercises I want you to look at. And the first exercise is rather easy. All you have to do is stick out your tongue as far as it can go. You can either try and touch your nose or touch your chin, it doesn't really matter. But stick it out as far as you can and then hold it there for 5 seconds, sort of like that. I think it's rude to stick my tongue out in front of camera, I'm so sorry. So hold your tongue out for 5 seconds and then pop it back into your mouth again. And then repeat that about 3 times. Now some people may find that quite difficult because they have a tongue tie, that little sort of fibrous bit underneath your tongue that stops you from sticking out your tongue as far as you possibly can. And if you have a tongue tie and when you pull out your tongue it hurts because it scrapes along your lower teeth, then instead of sticking out your tongue as far as you can curl your tongue on the inside of your mouth. So it rolls up or rolls down, but you can keep trying to pull out your tongue at the same time. So like that. It gives roughly the same effect without causing damage to the underneath of your tongue. Another way you can do this is to use a spoon, a bit like this. And what you do is you push your tongue against this spoon, like, again, hold it there for 5 seconds, put it back in your mouth and do it 3 times. When you find 3 times a bit too easy, you can go on to 5 times, 10 times, and therefore strengthen up your tongue as much as possible. So the next exercise is that you're pushing the whole of your tongue up to the roof of your mouth and sucking on the roof of your mouth and holding it there for 5 seconds. You repeat that about 3 times and then relax in between each one. Again, if you get better at this, you can hold it there for longer, but do try and hold it there for as long as possible. If you find that too easy and you've done this a few times and you've got a bit stronger, what you can do is slowly open your mouth when you do it. Or you can even look up at the same time. And you can feel a different type of pull, a different type of stretch. With time, when you get stronger at this, you can do this 5 times, 10 times, whatever you feel that you can manage. So the next exercise is going left and right. Now we've gone forward, we've gone up. Left and right is that you push your tongue into the cheek of your mouth here. But all that really does is stretch. And what I really want you to do is strengthen the tongue. So when you push your tongue into the cheek of your mouth, just push against your fingers like this. And do the same on the other side. Now at the start, maybe just do them 2 on each side and then build up, like I said, maybe 5 on each side. You'll find that when you push this way, you'll find the strain on the muscle over here, and that's what you're trying to strengthen. And you do the same on the other side to strengthen this side of the muscle. Now the next exercise is that you're trying to bring your tongue back down your throat. You've gone outwards, you've gone up, left and right, now you're going down the back of your throat. Now this is quite tricky. What you need to do is probably start by looking into a mirror and looking at your tongue, and then practicing dropping it down your throat and holding it there for 5 seconds. So it's sort of like and you'll just feel it dropping down and just hold it there. It can be quite difficult. Sometimes if you go too far, you feel like you're gagging on yourself. And obviously that's not what I want you to do. I just want you to get to a relatively comfortable position where it's tightening up your throat. If you manage to look in the mirror at the same time, you'll see the uvula or the dangly thing, the punch bag, lifting up at the same time, then you know you're roughly doing the right thing. Because what I'm trying to do is strengthen up the muscles at the back of the throat. Again, drop your tongue down the back of your throat approximately 3 times for about 5 seconds each time. When you get better at it, you can do that longer. So the next exercise is that you're pushing your tongue against your front teeth like that, holding it there, and then trying to swallow at the same time. Try and do that 3 or 5 times just to strengthen everything up in your throat. If you find that too easy, look up a little bit, and that makes it harder and causes a bit more strain on the muscles. If you want some bonus exercises, you can also do the vowel sounds. What I mean by that is that you go through A, E, I, O, U, but what I want you to do is when you say these vowels, I want you to really exaggerate and strengthen up and tighten the muscles in your throat. So you go E, ooh, like that. Again, try and hold it there for 5 seconds. It looks ridiculous, but the idea is just to tighten up different parts of the muscles at the back of your throat, which should hopefully make things better for you. Hopefully you found this useful, and if you did, please do subscribe because I'm trying to bring up more things on this channel which will help people with snoring and sleep apnea in particular. If you'd like to see the slightly longer version of this video, I'll leave that here somewhere, and it has a few more extra details for you. Thank you very much.